a multi-country study that is now ringing loud alarm bells. I have with me Dr. Nageshwar Reddy, chairperson of AIG Hospitals, Padma Vibhushan, and co-author of a very important study that now seems to suggest that India could become an epicentre for superbugs. What is the study and why do we all need to take note of it now?
So this was a study which was done in 4 countries, in AIG in India, Netherlands, Amsterdam, Italy, Milan, and Philadelphia, United States. So what we did in this study is that we actually looked at the prevalence of bacterial resistance in the community. This is not patients admitted in the hospital, but patients who came to the hospital for some procedure like endoscopy. So we looked at the bacteria in the nose and in the gut to see what is the resistance.
Because so what that means is that it's not people who are already in the ICU and therefore with some multi-drug resistance bacteria, but people who are probably part of the general population. They reflect the general population.
Exactly. So we call this the community resistance. So we looked at the antimicrobial resistance in the community. And the best way to do it is look at normal people who come to the hospital for routine procedures. So we took this and we did a very sophisticated culture and genetic analysis of the bacteria that were there. And what we found in the study was that 83% of bacteria of those who are coming to a hospital in India where antimicrobial resistance was there. Whereas it was only 10% in Netherlands, 20% United States, 30% in Italy. Which means that our people, normal community, not patients, people in normal community are harboring bacteria which are resistant to very high-end antibiotics. And
are you saying that 8 out of 10 people are having this multi-drug resistant bacteria in their bodies?
Yes, 83%, little more than 8 of the 10 persons are having this multi-drug resistant bacteria. And we tested for very high-end drugs, and many of these bacteria like Pseudomonas, Enterobacteriaceae, Acinetobacter, all these are bacteria which can cause severe infection in the body. If they go into the bloodstream of the person, they cause severe infection.
So does this mean that even for very routine infections, what we call, we will start becoming resistant to that, or there will be no treatment?
Yeah, so this indicates that if these bacteria come into the body, then we become resistant. All antibiotics except very high-end 1 or 2, all other antibiotics are these bacteria are resistant, and therefore even if you get a lung infection, small lung infection, you won't be able to treat it adequately because these bacteria are very resistant to all the antibiotics.
And we talk about the high-end antibiotics as well, which are able to fight even the multi-drug resistant strains. In that case, what was your study saying?
No, even the high-end antibiotics that have been used, these bacteria are resistant. There are only 1 or 2 antibiotics left which they are not resistant. Majority of the antibiotics are resistant. So the category, in fact, we still have the first generation antibiotics, the second, third. They're resistant to all this. Only the last 4th generation, few of them, they're sensitive.
What is the implication for healthcare in such a scenario for a country like India, which obviously is already so burdened with healthcare costs?
Yeah. So I think the implications are huge. It's implications about health and implications about the economy. The health implications are that the patient comes for a procedure to the hospital, he gets the procedure done. Unfortunately, during the procedure, surgery or whatever it is, if this bacteria escape into the bloodstream of the patient, then he develops septicemia. You keep on giving antibiotics, and these antibiotics are not effective. More costly antibiotics, they go into ICUs, and you'll find that many of the people or patients in the hospitals are dying of septicemia, which cannot be controlled by antibiotics. This is the consequence. The economic consequence, of course, is that these antibiotics are more costly, hospital costs increase and so on. So this has got a huge impact on our health and economy.
We used to very often talk about TB, the drugs for TB and resistance because people are not consistent with their usage. What are the implications in this particular case? Why is it happening? I know that we do abuse antibiotics, but tell us the scenario.
Yeah, so we used to in fact worry about tuberculosis. We still worry, but tuberculosis is better because the tuberculosis therapies are well regulated. The doctors are following up, and patients just don't take it on themselves. They take a full course. there are two important reasons why this antibiotic resistance is coming to a population. The reasons are, one, because we are not using the antibiotics properly. For example, for viral fevers, people are taking antibiotics. For a short one-day fever, antibiotics are taken. This is the first. So misuse of antibiotics. Second is the wrong use. The wrong use meaning they don't take the full course of antibiotic. You have fever, you take 2 tablets of an antibiotic, you feel better, you stop it. So when you use partial antibiotics, these bacteria are very intelligent. They've got this drug coming in and they develop genes which can develop resistance to this bacteria. So these are the two main causes.
In a country like India, we feel happy that we are able to buy, medicines off the shelf without doing it. What is the implication that you're seeing here in the long term as well? Because what is the scenario when you're saying 83% are actually drug-resistant bacteria?
So this is, I think, one of the things that over-the-counter antibiotics are going to be extremely harmful. Actually, if you look at government regulations, Schedule H or H1, we are supposed to give antibiotics only on the prescription. But very often the pharmacy guy just asks the patient, "Oh, fever, take this antibiotic," without even. The second is all these online prescriptions that are going on. We cannot dispense an antibiotic online like this. Unfortunately, that is started and this is going on. So I think antibiotic prescriptions have to be very carefully regulated. You can't just do online or just over-the-counter antibiotics. Government regulations are strict. We have to follow them, and the government has to enforce that this is followed. Just like narcotics cannot be prescribed easily, they have to follow the same thing with antibiotics. In fact, I'm a little worried because the implications are huge. The amount of resistance is so large that one day we end up with a situation where no antibiotic is going to be useful even for simple infection. So we have to be very, very serious and cognizant of this.
One is human usage of antibiotics. The other, we're using it for livestock. We're using it for the fish and shrimp and even in agriculture.
Yes, so this is a very important point. It's just not misuse of antibiotics, it's not pharmacies, doctors, people, but it's also the whole ecosystem. So there are many stakeholders in this. For example, in agriculture, I'm surprised antibiotics are used. Poultry, in fact, one of the most abuse occurs with poultry. So the chicken and so on, they're fed with a lot of antibiotics. Similarly, milk, again, contains an aquaculture, fish, shrimp, aquaculture, lots of antibiotics. So you're getting your antibiotics from different sources, not only just from the pharmacy, but from our food source also. And this is something which has to be acted very strictly. In most advanced countries, there are very strict regulations. In India also, I think both the national and state governments are having strict regulations, but unfortunately, these have to be followed very strictly, otherwise not going to be useful.
How will the public know, whether it is livestock or otherwise, what is the advisory that you have for the general public vis-a-vis their own consumption and vis-a-vis these food items?
I think public education is very important. Unfortunately, the public don't know what's happening in this situation. They're totally ignorant. When we actually did this study and we asked, these are patients who came from all over, people who came from all over the country, and we asked them, have you used antibiotics earlier? They're not aware. But actually, when you go detailed history, sometimes they had a small cold and somebody gave them antibiotics they didn't even know. Plus, they were getting antibiotics from the food sources which they didn't know. So it's going to be very difficult for the public themselves. All they can do is not use antibiotics unnecessary, only use it on doctor's use, and use the full course of antibiotics. Now, regarding the food sources, I think it is the duty of the government and other regulatory agencies to see that these are very strictly controlled, because the public, unfortunately, cannot control that. It's very difficult to do that.
India is also a huge destination for medical tourism. Hospitals like yours draw patients from across the world now. What is the implication for that?
I think we have to be very careful now, because once, if people do think that we have a lot of these organisms, they would be a little worried about coming. So that's the reason why I think we should act very fast. We should act very stern, and public education, doctors' education, government regulation. These three things should come in force immediately. I see that in the next 5 years, if we do this, we can get it down to 40% or less. In next 10 years, maybe get it down to what Western countries are seeing. If we are very, very strict, if we are not, then we are going to be in a catastrophic situation.
Yes. Obviously, public awareness is important. So you are saying this is a reversible thing. Now, if you're saying 83% of the population is having resistant bacteria.
So this was actually shown earlier in Netherlands, where they had initially a much higher incidence before all the regulations came. From 30%, they came down to 10%. So which means that this is not something which is permanent, which very quickly reverses, because antibiotic resistance is a very dynamic genetic transformation that occurs in the bacteria. You can very quickly reverse it if your regulations are very strong. I know that in a country like this, which is very large, diverse, different states, it's not so easy, but we have to take it up as a very, very strong priority. This is going to be a national problem. We have to be very serious about it. But if public, doctors, government, agriculture, everybody collaborates, then we can get it down to much lower incidence, and we can reach what is happening in the Western world.
You spoke about 4 countries where the study was done, and India ended up being the highest and shocking everyone as part of the study. What I want to ask you is, while this is very sensitive, are there implications? I mean, in terms of today, Indian citizen is a global citizen. He travels everywhere, and along with him travel the bacteria.
Yeah. So that's another problem. So that's why I think a lot of time the checks are done in the nose and all that. When they go to another hospital abroad, nasal swabs are taken to check. But it's not just the nose, it's actually the gut which is harboring majority of this bacteria. And it's very difficult to test the gut bacteria routinely. So that's why these tests are not done. But I think for us, now that we have this study, we have the implications, we have to take very strict actions, and we can reverse it.
I just want you to talk to the government and through our TV, talk about what you think need to be done, because this is such an important study for the country, whether it is the citizens or the government.
No, I think my appeal would be to the citizens: kindly don't take unnecessary antibiotics unless there is a strong indication, and kindly take antibiotics under the doctor's supervision, and kindly take a full course of antibiotics. Don't stop it at the end. This is citizen. Government, of course, is very wise. They already know. I think there are several government agencies that are there, and they have already put in a lot of regulations, the Schedule H, for example, or they have a lot of GOs, which I told you are coming in both Telangana, Andhra Pradesh, and nationally. So they're already there. I think there the implication would be to have more strict regulations. Be very, very tough with those people who are not following the regulations. Only then we can control this, and this is very important for health and economy of our country.
Thank you so much, Doctor. So certainly a wake-up call for the country now. These kind of figures are extremely worrying, and the implications in the next few years going to be quite catastrophic unless the public and the government both wake up. In Hyderabad, with camera person Nagraju, Uma Sudhir, NDTV.